Okay, good afternoon. My name is Brian Rodriguez. I am the systems administrator as well as the project manager for the San Francisco Health Service System. I want to welcome you to today's webinar, which is the Active Employee Vision and Dental presentation. As we begin, a few housekeeping items, if we could go to the first slide. All right, so for today's webinar presentation, everybody will be on mute. All attendees will be on mute. However, if you notice up in your menu bar, you should see an icon or could potentially be down in your lower menu bar, depending on how you're joining today. You should see two chat bubbles, one with a question mark in it. That's your Q&A chat. So you can click on that and you can send us questions in the Q&A, and either someone from HSS or our vendors who are online with us today will be answering your questions. And we will do that at the end of today's presentation. So without further ado, let's go for it.
Hi, my name is Emily, and I am one of the 25 SF Health Service System Benefits Analysts who answers your calls when you have a benefits question. We're so glad you've joined us for the Dental and Vision Benefits webinar because I personally experienced a situation in which I was not familiar with my dental benefits and went through a tough time with understanding what was covered. I had a lot of back and forth communication with my orthodontic office, and I later realized that I could have called SFHSS, who would have been able to tell me that the service had a maximum that I had already reached, or they would have directed me to contact my dental insurance for this information. So the lesson is to stay informed of your benefits, which you have already done the first step by attending this webinar, and that you can always call SFHSS if you have any questions or are unsure of your benefits. I hope you find this webinar to be helpful and informative. Cheers and happy open enrollment.
Welcome to Delta Dental's Keep Your Teeth for a Lifetime by using your PPO dental benefits for active employees. Today, we're going to cover why dental coverage matters, COVID-19 and dentistry, review of your dental benefits, and dental plan resources. Why does dental coverage matter? Let's have you answer the following question. How many American adults have had a cavity? If you answered D, 92%, you are correct. 92% of adults ages 20 to 64 have had cavities in their permanent teeth, and 26% have untreated tooth decay. By having dental insurance, you stop problems before they start. Half of adults are affected by gum disease, and the most prevalent chronic disease in children and adults is tooth decay. What happens during a cleaning? Let's watch this short video and see what happens.
You probably already know that brushing and flossing daily is important to keep your smile healthy. But that's just the start. To prevent cavities, lower your chance of gum disease, and improve your overall health, it's important to visit your dental office for regular cleanings. Your teeth are covered with a naturally occurring sticky film called plaque. Left alone, plaque can build up and harden over time to form tartar, a magnet for bacteria that can harm your teeth and gums. A dental cleaning can remove the plaque and tartar. First, your dentist or hygienist will use a small tool called a scaler to scrape away the plaque and tartar from your teeth. Then, she will use water and a suction tool to rinse and clean your mouth. A rotating polishing tool combined with gritty toothpaste will then make your teeth shiny and smooth. Finally, your teeth will be flossed to clean the space between teeth. When you're done, be sure to give yourself a pat on the back. You are catching problems before they start and keeping your smile healthy. For more information on dental cleanings, visit our website.
So how has the dental appointment changed since COVID-19? Is it safe to visit a dentist? And the simple answer is yes. Your dentist disinfects the surfaces in your treatment room and sterilizes the instruments used in your mouth. Many items used are disposable, single-use items that are discarded after a patient's use. And your dentist may look a little different when you return. You may now see your dentist wearing a special mask, a face shield, a gown, as well as other items in the dental room. Other strategies that your dentist is doing to keep you safe is one, the health screening before entry. You'll receive either via email or text message from your dentist a COVID health risk questionnaire. You will be responsible for completing that prior to your appointment and the day of your appointment. Your temperature will also be taken, and you might see less patients in the waiting room, as well as no longer coffee service or magazines. These are all items that have been removed or done to keep you safe. If you're still a little fearful about going into the dentist's office to get an exam, you receive 2 exams per year with your coverage, your dental coverage. But if you're a little hesitant, there are teledentistry ways to have an exam. One is the toothpick approach. This is a mobile app which you would complete a dental health and habits quiz. You would take photos of your teeth, and the app helps direct and create really good clinical grade photos. You would remit the quiz and the photos via the app, and a licensed Delta dentist will provide you a report within 24 hours. If there's any concerns, that will be listed on your report. If you would prefer to speak with a Delta dental dentist, you can do so by scheduling an appointment through virtual consult. This is a real-time video appointment via your computer with a PPO dentist. It may not be your particular PPO dentist, but a PPO dentist that has agreed to provide virtual consults. This dentist can also prescribe prescriptions if necessary. Both utilizing virtual consult and toothpick would count towards your diagnostic exam frequency. You do not need to use both. You can use one or the other, or continue to go into your dentist's office and seek your exam in the chair. Your mouth and your body have far-reaching impacts. For glaucoma, a disease of the optic nerve, tooth loss and gum disease may increase your risk of this condition. For migraines, certain bacteria may be linked to cause migraines. And for acid reflux, this can be detected by looking at enamel on your back molars. Hopefully you're all familiar with the active employee Delta Dental PPO benefit highlight sheet shown on the slide. Deductibles, there are none. And your maximum is $2,500 per person each calendar year. So you have up to $2,500 to spend on your dental care. Diagnostic and preventative, exams, cleanings, and x-rays are covered at 100% if you seek services from either a Delta Dental PPO dentist or a Delta Dental Premier dentist. For out-of-network dentists, your coinsurance would be 20%, and we would pay 80%. An enhanced benefit nitric oxide, and non-IV sedation was added to your benefit program starting January 1st of this year, 2021. And as you can see, there's no waiting periods. There's additional support for chronic conditions. If you've been diagnosed with diabetes, heart disease, HIV/AIDS, rheumatoid arthritis, or stroke, you can take advantage of expanded dental benefits. All you need to do is enroll in the SmileWay program. You can do so by calling Delta Dental's contact center at 888-335-8227 and ask to be enrolled in the SmileWay program. By enrolling in the SmileWay program, you'll receive additional coverage, 100% coverage for one scaling and root planing procedure per quadrant per year, and 4 of the following per calendar year of any combo: teeth cleanings or gum maintenance. There's also support for women who are pregnant. If you're expecting a baby, you can receive 1 additional oral exam and either 1 additional routine cleaning or periodontal scaling and root planing per quadrant. There is a difference in seeking services from a PPO dentist versus a non-Delta dental dentist, an out-of-network dentist. You'll save the most by seeking services from a PPO dentist. If you are seeking dental treatment in excess of $300, it is recommended that you request a pre-treatment estimate from your dentist before receiving dental care. A out-of-network dentist can balance bill members, the difference between Delta Dental's payment and their submitted fees. To demonstrate this, the implant benefit is being used as an example. You can see your annual maximum of $2,500 across on the first line, and the individual deductible, there is none. Your dentist charges a submitted fee, and that's $2,400 in this example. The plan, Delta Dental, has approved accepted fees. That's $1,600 for a PPO dentist, $2,200 for a premier dentist, and $2,400 for out-of-network dentist. But the maximum that your plan allows for coverage or payment on an implant benefit is $1,600 for PPO, $2,200 for premier, and just $2,200 for an out-of-network dentist. So you see here where there's a $200 delta between what was an accepted fee and what the plan maximum allowance is. Your coinsurance is 50%. Delta Dental pays 50%, $800 for PPO, and you would pay $800 for this service. Whereas if you sought services from a premier dentist, 50% coinsurance of $2,200 is $1,100, and you would be responsible for $1,100. Where the balance billing and the most out-of-pocket would be experienced is in an out-of-network dentist, where Delta Dental will pay $1,100 and the patient would be responsible for $1,400. Comparing Delta Dental PPO to Delta Care USA. During open enrollment, this is the one time a year that you can move, if you so desire, from a PPO plan to a Delta Care plan or vice versa. To have a little better understanding of a PPO plan versus a Delta Care USA plan, let's go through some of the questions here. Can I go to any dentist? Yes, under a PPO plan, you can. Whereas under Delta Care, you would select a primary care dentist and visit this dentist to receive your dental benefits. What about procedures being covered? Under a PPO plan, you have a coinsurance, such as that 50% that we showed in the prior slide for the implant example. Under Delta Care, there's no or low co-payments for treatment. What if you needed to see services from a specialist? Under a PPO plan, you do not need a dental referral. You can go to any dentist of your choice. Whereas if you need to seek services from a specialist under the Delta Care plan, you would need to receive a referral from your primary care dentist. And the most important is out-of-network coverage. Outside of California, you can see any licensed dentist under the PPO plan. However, Delta Care, you would only be covered for a dental emergency. BrushSmart is another program that we put into place for at-home oral wellness care. There's a partnership with Philips to provide discounts on Philips Sonicare products. To learn more about this benefit, go to brushsmart.org and learn about the discounts on the many Philips Sonicare products. There's some dental resources that are provided on your microsite. There are articles, short videos, tooth-friendly recipes, quizzes, and our Grin magazine, which you can actually sign up for. It's a quarterly e-magazine. Online accounts are very important, and it's easy to create one. Go to https://www.deltadentalins, all one word, .com/group-sites/ccsf.html. That's your microsite. And when you go to your microsite, in the middle of the page, you'll see Sign In, Register. Click on Sign In, Register, and follow the easy directions to create your online account. By doing so, you can receive your explanation of benefits or pre-estimates electronically. You can review your dental plan details, and you can verify who's covered under your dental plan. You can also view or print an ID card. However, if you are seeking services under the PPO plan, dental plan, you do not need an ID card. Delta Care, you will be issued an ID card. Ways to contact Delta Dental. You can call us toll free, and the PPO Delta Dental plan number is 1-888-335-8227. Or for the Delta Care plan, you can reach us at 800-422-4234. You can also visit your microsite and find a wealth of information about your plan design, your plan booklets, and other important information. Checking your benefit highlights and plan booklet on an annual basis is a good idea. Thanks for your time, and we're pleased to take your questions.
Thank you for taking the time to view your United Healthcare dental HMO benefits. So who is eligible for coverage? Employees and retirees. Eligible dependents includes spouse, domestic partner, children up to the age of 26. Good oral health may be linked to reducing the cost and complications of many high-risk, costly conditions such as diabetes and heart and kidney disease. Our whole person approach is designed to link medical and dental data to help close gaps in dental care for employees with chronic conditions, with the goal of helping improve overall health and lower costs. Gaps in oral care are characterized as a lack of oral health care received within the previous 6 months, as well as the type of oral health care being received. We outreach to identified employees to help them close their dental care gaps, which may help them achieve better health and save money. Condition-specific data, such as diabetes. People with diabetes are more likely to have gum disease if left untreated. This can make it difficult for them to stabilize their blood sugar. However, those who receive gum disease treatment may see a positive impact on their blood sugar levels. Heart health. People with gum disease are nearly twice as likely to have heart disease. Pregnancies. Gum disease in pregnant women may be linked to complications such as preterm birth and low birth rate. Asthma. Employees taking asthma medications may be at risk of cavities, dental erosion, periodontal disease, and oral candidiasis. Kidney disease. Treating gum disease helps reduce inflammation, which can reduce the risk of kidney failure. Chronic obstructive pulmonary disease, or COPD. Periodontal disease may increase the risk of respiratory diseases. We address individual needs with a whole person approach that includes both preventative and at-risk outreach. 98% of targeted employees were successfully reached by phone and/or mail. Preventative care includes wellness benefits covered at 100% in network, 2 routine checkups every year. Extra cleaning and treatments are for expectant mothers, extra dental visit during pregnancy, annual oral cancer screenings for covered adults age 18 and up. We help at-risk employees through enhanced benefits that provide additional preventative and periodontal benefits, including expanded coverage for pregnant employees. Dental activation combines medical and dental data to help identify at-risk employees and assess whether they're getting dental care to manage their condition. Timely interventions. This encourages employees to seek oral health care. Select managed care, or DHMO plans, help maximize savings through a more localized network and focus on coordinated care. Plan characteristics include no deductibles, no annual maximum, and no waiting periods are required. You must select a primary dentist within the state which you live in. Referrals are required to use a specialist, and you can only see in-network coverage providers. Here we see a snapshot of restorative services and what the cost may be for these. Although many of these services are at no cost to you, there are some services with a copay cost. So please refer to your plan summary for additional information. Preventative services are at no cost to you. It's your choice. You choose a network dentist for yourself and each one of your family members. You show your ID card at the dentist's office. You pay your copay, if any, and your claim will be submitted for you. A few points to remember. We'd like to point out that each dentist on the network is board certified. No deductibles and no annual maximums, and no waiting period is required. No claim form for coverage services is needed. Low predictable dental cost. Good oral health may be linked to reducing cost and complications of some high-risk costly conditions such as diabetes, heart, and kidney disease. Individual needs are addressed with a whole person approach. Preventative and at-risk outreach is included. And please remember that only services within the dental network are covered. Are you ready to enroll? Well, first, we encourage you to review your plan materials. Second, go online and visit www.yuhc.com/SFHSS. You must enroll during your initial eligibility period or annual enrollment period. Thank you for your time.
Thank you for taking the time to learn more about the vision benefits San Francisco Health Service System is offering you in partnership with VSP Vision Care. When you choose a VSP Vision Plan, you will receive great savings when you visit a VSP Network doctor. With both the Basic Plan and Premier Plus plans, a well vision exam is covered in full every calendar year with a $10 copay. Both plans also include primary eye care, which includes treatment and monitoring of common eye conditions like pink eye, as well as more serious conditions every calendar year with a $5 copay. With the basic plan, prescription lenses are covered every other calendar year, a frame allowance of $150 every other calendar year, fully covered single vision lined bifocal or lined trifocal lenses for adults, as well as fully covered single vision lined bifocal or lined trifocal polycarbonate lenses for children every other calendar year. The base plan also offers scratch-resistant lenses and standard progressives covered in full. Or you can choose contacts instead of glasses with a $150 contact lens allowance with a copay of up to $60 for the contact lens exam every other calendar year. With the Premier plan, prescription lenses are covered every calendar year, a frame allowance of $300 every calendar year, fully covered single vision lined bifocal or lined trifocal lenses for adults, as well as fully covered single vision lined bifocal or lined trifocal polycarbonate lenses for children every calendar year. The Premier plan also offers scratch-resistant lenses and standard progressives covered in full. Premium and custom progressive lenses, as well as anti-glare coating, are covered in full after a $25 copay. Or you can choose contacts instead of glasses with a $250 contact lens allowance with a copay of up to $60 for the contact lens exam every calendar year. Now let's dive into the great benefits and savings you get as a VSP member through San Francisco Self-Service System. VSP members save an average of $851 every year with a VSP Network doctor. And savings are built into your plan, which means you'll get a great deal on services like eye exams from the nation's top providers, fashionable frames and prescription glasses and sunglasses, lens enhancements like anti-glare coating and light reactive lenses. You'll also enjoy savings on additional lens enhancements and contact lens services. Based on applicable laws, benefits may vary by location. We have the right network in place, including independent private practice doctors, Premier program locations, and VSP's preferred online retailer, Iconic. There are more than 8,000 regional retail chain locations on the VSP network. Our retail chain providers also include Costco, Optical, Pearl Vision, and VisionWorks. All VSP members have access to the Premier program, which is part of our incredible network of highly knowledgeable doctors. VSP Network doctors who participate in the Premier program provide the personalized attention you want and the ease you need. They also carry the latest technology available and provide bonus offers that are exclusive to Premier program locations. Simply put, members get the most from their benefits when they visit a Premier program location. As a VSP-owned company, Iconic is the only website that seamlessly connects VSP Vision benefits to a member's account. By applying your vision benefits, you see savings in real time. Save time and money on quality eyewear with a few easy clicks. 1. Connect your vision insurance. 2. Select your product. 3. Upload your prescription or provide your doctor's contact information and we'll take care of the rest. Iconic offers a variety of well-known name brands and contact lenses. Choose from over 50 eyewear brands and over 1,600 styles. At VSP, our commitment to your well-being extends to your financial wellness. Members get access to exclusive member extras, up to $3,000 in savings on leading industry brands. Plus, VSP members always get an extra $20 to spend on featured frame brands. That way you get the low out-of-pocket cost your family needs. Exclusive member extras includes special deal on glasses, extra $20 on featured frame brands, save up to $20 on non-prescription sunglasses, Save up to 60% on digital hearing aids. Visit VSP.com to see additional savings on LASIK, diabetes care, hearing aids, and financing. Offers vary based on your benefit plan. And using your VSP benefit is easy. Once your plan is effective, you can create an account on VSP.com to review benefit information and view the doctor network so that you can find an eye care provider who's right for you. And don't forget, you can maximize your savings when you visit a Premier program location. Then, at your appointment, simply tell your doctor's office you have VSP. There's no ID card needed or claim forms to complete when you see a VSP network doctor. While a member vision card is not needed to obtain services, you can download a member vision card by logging into your VSP.com account. A note on enrollment. If you enroll in the Premier plan, you must also enroll any dependents you wish to be covered. Enroll in VSP Vision Care from October 1st to October 29th to enjoy the complete coverage and the quality care you deserve. To learn more, contact us at 1-800-877-7195 or visit us at VSP.com.
Okay, now that we come to the part where we can answer some of your questions that have been posted in the Q&A, I'll go ahead and start reading some of them here. All right, looks like the first question was asking to put the microsite for Delta Dental into the chat. So thank you, Sharon, for doing that. I'll go ahead and read it out just so that folks have it audibly as well. It's https://www.deltadental.ins.com/group-sites/CCSF.html. Thank you for that. And also as well, the UHC dental microsite was posted into the chat. Thank you, Sonali. That one's a little too long for me to read, so I will recommend that folks look at the Q&A chat for that specific link. Let's see, the next question is, does Delta Dental PPO cover down payments? If it doesn't, can I ask my dentist to count my down payment toward my monthly payments instead? The evidence of coverage does not say that it does not cover down payments. And so, Sharon, I know you asked, or excuse me, you answered this one in the chat, but if I could ask you to answer it audibly as well.
Yes, I'm assuming that what the member that is asking this question is referring to by down payments is you're at the dentist's office and you're going to have some dental procedures done, and the dentist is asking for upfront money. So in essence, a down payment. If that is the scenario, then yes, I mean, that amount would show up as a credit. So when your dentist completes the treatment, submits the dental claim to us, they should reference that on the dental claim that there was a prepayment amount. It will also show once the EOB is generated, so from us, and if you don't see that credit on the explanation of benefit statement, then once your dentist receives payment from us on those dental procedures, they should then adjust or send out a new invoice to you indicating here's the dental procedures that were done, here's the cost, and then here's your down payment, which is the credit, and then if there's any balance of owed amount. So I hope that answers the question, but more than happy to talk offline with this member if they want to give me a quick call.
Okay, great, thank you. So let me take a look at the, excuse me. The next question is also for Delta Dental, and Sharon, you answered this one, but again, I'll ask you to answer it audibly. If I go over the maximum coverage, Delta Dental PPO dentists, do I just pay the difference?
And yes, so, and I want to, in my response, I want to make sure that we understand the difference here that we're talking about. So kind of going back to that example of the implant coverage and where we were talking about different dentists, right? A PPO dentist, there's the premier dentist, and then there's the out-of-network or non-contracted dentist. So we've got, you know, that submitted fee, and then we've got a maximum plan allowance. And as you can see from that example, there's a maximum plan allowance for PPO dentists, and then there's one for premier, and then in essence, where we just apply the PPO allowance to out-of-network. So what you just want to be mindful of is if you've utilized the 2,500, we're still going to apply either the PPO contract allowance if you're seeking services from a PPO dentist, or the premier maximum contract allowance if you're seeking services from a premier. However, when you're seeking services from an out-of-network dentist, you know, we're applying our maximum allowance, and then so you're in essence paying for that contract amount, right? Because it's not going to be the, well, with the out-of-network, you're going to be basically paying the full dental cost. Whereas with the PPO or premier, you're just going to be paying those contracted or maximum plan allowances. So I hope that is helpful. But again, by contacting our contact center, or if you want to touch base with me online, I'm more than happy to do so.
Okay, great, thank you. And I think this next one goes over to you, Sharon. This is, what is the BrushSmart program, or what does the BrushSmart program give me, and can dependents use it too?
Yep, and so both members and dependents who are enrolled in the Delta Dental PPO plan have access to the BrushSmart program. It's free, you don't need to enroll. The program provides a 20% discount on many listed Philips Sonicare products, and which are noted on the site. And so again, that's just if you put in your browser www.brushsmart, all one word.com, it'll take you to that site, and then you can look through all the different products and then order online, and you'll get that discount, and it's shipped directly to your home.
Great, thank you. The next question is, are computer glasses covered for early retirees? And thank you, Sonali, for posting the response to that, and I'll go ahead and read it. VDT, or computer glasses, coverage is only for active employees. Thank you for that. And then also, there was a second or a follow-up to that. Computer glasses are covered by certain unions per their contract, and to check with HSS to see if you are eligible for computer glasses. And Sonali had also posted in the chat our phone number for member services for HSS, which is 628-652-4700. Or you can go to our website, which is sfhss.org/contact-us. And the next question for Delta Dental PPO orthodontics coverage, is there a waiting period before we can start orthodontic treatments? And I'll ask Sharon to answer that one again.
Yeah, and so there's no waiting period for orthodontics. However, again, I'm not sure of the extent of this question. So I just want to be mindful of if you've already started treatment for orthodontics under a different dental plan, maybe you're a new hire and you're coming from a plan where you've started that orthodontic treatment and you're wondering about the continuation. So my recommendation would be to call our contact center to learn more about the ins and outs of if you are transitioning, right? You've already started treatment or you've had treatment in the past and how that would be covered under the SFHSS PPO dental plan. And then, of course, the Delta Care plan also provides orthodontic coverage.
All right. The next question, are CCSF employees covered under a dental PPO? I'm assuming that's what the question is. But thank you, Jessica, for this response, and I'll read it out. City and County of San Francisco employees have access to all of the dental plan choices from HSS, both the Delta plan as well as the United Healthcare plan. If you are a city college employee, then you will need to work with your particular HR department about your dental benefits, as SFHSS does not administer the dental benefits for city college. And going on to the next question. If I know that I will be needing a lot of gum work and implants being done in 2022, which plan offers the most insurance coverage? So this goes to both of our representatives for dental coverage today. I'm going to give Sharon a quick break and ask UHC to answer this one first.
Hello. So that's actually a difficult question of the DHMO. The DHMO, as you know, doesn't have a calendar yearly limit, but to give you an exact amount, we would need to know the ADA codes in order to give you that answer. We do have an office meeting scheduled for later today. If it's more of an individual personal question, then I recommend you join that call.
Great, thank you. And I will ask Delta Dental to answer that as well.
So for our Delta Care USA, which is basically the dental HMO plan, currently your plan design does not cover implants. So the plan that would be the PPO plan, and that is covered at, looking really quickly. So there's a 50% co-insurance. So we would, and again, going back to that slide, 50% is the co-insurance we would apply, and then 50% would be your responsibility. And then you do need to be mindful of that calendar year maximum of $2,500 per person. So what we recommend is, if possible, straddling 2 plan years when you're having costly procedures. So there's kind of a twofold. To straddle would be starting the procedure now in 2021, if you still have that calendar year maximum. And then, of course, then it resets January 1st. And so then you'd have an allotment of $2,500 for the next year's. And then the date of service drives when what maximum, so the bucket of maximum is being utilized. The other we highly recommend is pre-estimates. So definitely asking your dentist to submit that prior to having any treatment, anything over $300, because that will provide a really detailed list of the different procedure codes that are going to be in your treatment plan, and also how the benefits are being applied. So that 50% co-insurance.
Okay, thank you. The next question, I believe this is our first vision question. For the basic vision plan, do we receive a card with insurance information that we can show the optometrist's office? And Nancy, I know you answered this in the chat, but again, I will ask you to answer it audibly, please.
Yeah, so none of our providers actually require ID cards at the time of service. I know a lot of our members do prefer to have an ID card just to kind of remind them of the benefits. So what you can do is log on into your account on VSP.com, and there is an option to print up an ID card if you would like. But like I said, none of our in-network providers would ever ask for an ID card at the time of service.
Okay. And the next question is going to be for you as well, regarding VSP Premier. I see an eye doctor through Blue Shield Trio. I don't know if the eye doctor is part of VSP, but if they are, how does that affect my coverage, copays, etc.? In other words, how does medical insurance and VSP Premier overlap?
Yeah, so depending on what type of services you're seeking, whether or not there's a coordination of benefits, it would depend on what services you're seeking. So if it's say for just using an example, cataracts, for example, that would just be covered under your medical. But if it's for, an exam or something else, there could potentially be coordination of benefits between your medical plan and your VSP plan, assuming that this provider is a part of VSP's in-network list of providers.
Okay, thank you. Next question. I'm under Delta PPO and also under my partner's Cigna PPO plan. How do both plans coordinate benefits between each other?
So what's best in this circumstance is to let your dentist know that you do have two different dental plans, so that when the claim is remitted to us, we make sure that we coordinate that care with your other dental plan. In order to get kind of into more specifics, what I would do is either have you look at our your microsite, and we do have some information about dual coverage. Your evidence of coverage booklet also has additional information. And then another source of information would be calling our contact center just to walk through that scenario with them.
And the next question is a slight variation on this question, again for Delta Dental. My wife also has Delta Dental PPO at a different company. We both plan to enroll for 2022. Can you explain having dual coverage and how much will be covered, particularly with orthodontic treatment? If we each have a $2,000 lifetime maximum benefit, will the dual coverage effectively cover $4,000? Also, can you explain coordination of benefits with regard to dual coverage?
And this is, although it seems as though a very kind of simple, high level question, there's a lot of nuances that could go into this. We would want to look at procedure codes, dental procedure codes. We would want to look at that treatment. Has there been any pre-treatment prior to the utilization of those lifetime maximums? So for this one, what I would do is recommend either remitting that to the HSS group, and then they can send it over to me, and then we can have one of our group service representatives in claims really look at your profile specifically and go through this information with you. The other alternative would be, again, that pre-estimate that I mentioned earlier, having your orthodontist submit that in advance, letting them know also, right, that you've got dual coverage, so that we can then provide the information back to you on how this would work and how this coordination would best benefit you.
All right. Next question. How to know if a dentist is in the PPO plan or in the Premier plan?
Very simply, on our website, when you look for Find a Dentist, and you can just put in your zip code, either your work zip code or your home address, and when the directory is pulled up, it will show whether the dentist is PPO or Premier. It'll also give you some Yelp reviews, and we also have a Dental Qual, which is a independent analytic company that actually rates the dentist and provides a star rating as to their cost, the adherence to procedures and the standards of procedures. So just a wealth of information, and really, really easy to find a dentist by just using Find a Dentist.
All right. The next question, although there are some VSP benefits to shop at Costco, they really aren't considered in-network. Is there any anticipation which VSP would be able to share that would allude to the future network status of Costco, understanding that in-network would be most preferable? And again, Nancy, I know you answered this, but again, if you could answer it audibly for our members.
Yeah, so Costco is currently actually an in-network provider for SFHSS. At the time of service, you would just need to identify yourself as a VSP member. Our partnership with Costco is actually just with their optical center, so not necessarily with the providers that they have on site. And so you can go to Costco to get contacts and or glasses, and it is again considered an in-network provider for SFHSS members at their optical center.
All right, great. Again, the next question is for VSP as well. I have VSP Basic and have two questions. One, if I go to an out-of-network provider to purchase the contact lenses, how much does VSP cover? And question two, the plan covers contact lenses or regular glasses every other year starting January 1st. We can only pick one. Is that correct?
Yeah, so the out-of-network reimbursement for contact lenses is up to $105 for both the basic and premier plan. So if you do choose to go to out-of-network for for your contact lenses, just know that you may be reimbursed up to $105 under both plans. And with regards to the question number two, under the basic plan, yes, it's either a pair of glasses, so frames and lenses, or contact lenses every other year. If you are needing this on an annual basis, the Premier plan does offer one or the other every calendar year.
All right, great. The next two questions, I'm going to group them together, are for Delta Dental. Dependent needs wisdom teeth extraction to surgically. What is the contract price for extraction by a surgeon through Delta Dental PPO? Does the price include all procedure and medication used in the procedure? And then the second question, which is from a different user, is does Delta Dental PPO cover Invisalign?
Sorry. Two great questions. So let me start with the Invisalign real quickly. Yes. So under the PPO plan, because Invisalign is a specific product, such as like Kleenex for tissues, so we don't specifically spell out in the evidence of coverage booklet that Invisalign is covered, but it is covered under braces. It's considered braces. The other question regarding, oh my gosh, I just forgot. Oh, the cost. Thank you. Sorry. So we have a, it's called a cost estimator tool. And again, going to your microsite, Delta Dental's /SFHSS's microsite, there is a, under managing costs, it talks about our cost estimator tool, and you click on that, and what you can do is it'll give you like orthodontic, braces, crowns, implants, and it'll give you an estimated cost of those procedures, so you have an idea going just, before you even go into the office, what that cost would be. Of course, again, I know I sound like a broken record here, but submitting or having your dentist submit a pre-estimate, always a very, very wise decision before you start a treatment plan. And then one additional benefit with that cost estimator tool is if you go into your online account, so you've set up your Delta Dental online account, and go into the cost estimator tool through your online account, it actually will show you real time and apply any deductibles that you've already satisfied for the plan year. And I know we're talking about the active PPO plan here, that there are no deductibles, but again, just as a for instance. And then it would also demonstrate if you've utilized any of your calendar year maximum, so kind of what that balance is, and apply it to that estimate. So it's even giving you a better or more personalized cost estimate for that procedure.
Okay. Next, we have my dentist of 20 plus years recently told me that his office will no longer join Delta Dental due to Delta's very low payment. Your implant example shows only 2/3 is paid. What is the city and SFHSS doing about this? It's almost more advantageous to just not buy coverage and pay out of pocket. Also, the next question along the similar lines, over the past several years, at least 10 years, the cost of healthcare has risen, yet the maximum benefit for the Delta Dental PPO has remained static at $2,500. Are there any future plans to increase this maximum, considered it has not increased for 10 years? I will say that a lot of these two questions are technically out of scope for this particular webinar, but we will take these concerns back to our executive leadership because I know that these are definitely concerns that members have. I don't know if there's anything from Delta Dental, if you'd like to address anything for these.
Definitely. So the 2,500, why it's remained static is, and this is something that the executive team and Delta Dental partner every single year. We look at your utilization as a whole, as an aggregate of your population. And what we've shown year over year is for the majority of members, that $2,500 is more than enough to cover the dental needs. So there's a very small percentage of SFHSS active employees or members of the Delta Dental PPO plan that exceed that 2,500. So that's the reasoning behind why that's remained at 2,500. But again, we look at it every single year, and if the stats show that more and more members are having to have a greater out-of-pocket expense than 2,500, then we'll look at that number. As far as dentists leaving our network, we have been providing information during the board meetings to your board and to your executive team. So if you do look at past meeting minutes, there's a wealth of information about our dentists and how we're actually adding dentists both in our PPO and Premier network on an annual basis. With COVID, we did see a lot of dentists retire or sell their practice. When they're selling their practice and they're a Premier dentist, they are the new dentist coming in or the dentist that's purchasing that is at a PPO contracted rate, and sometimes that new dentist wants to be able to charge a higher fee to their members, and so they leave our network. So we're constantly watching this, especially for SFHSS, and we have reported on different areas within the counties that your members seek services from. And again, there's some one-offs of dentists leaving, but for the majority, our network is solid and we continue to add dentists.
Okay, great. Thank you. I do want to acknowledge that we are at 1 o'clock. We have 2 questions left, but I also did want to ask our moderators to post the raffle URL into the live Q&A so that folks attending today can enter into that raffle. We have some great prizes that have been put out by some of our vendors, so definitely make sure that you enter, and they'll post that in the chat and have that up on the screen momentarily. So our next 2 questions are going to be both for VSP. Is why are refraction fees not covered under an ophthalmologist? So again, Nancy, I know that you answered this in the Q&A, but if you could answer it audibly as well.
Yeah, so refraction fees are covered at an ophthalmologist's office under your VSP plan. You just, again, need to make sure that this provider is a part of VSP's in-network, is an in-network provider. Otherwise, the exams are typically reimbursed up to $50 if you do go to an out-of-network provider location. VSP.com, that's where you're going to find the most comprehensive and most up-to-date list of providers, and we have both optometrists and ophthalmologists as a part of our network. So again, the exam is definitely a covered part as long as the provider is in network under our plans.
Okay. The next question was a question about the monthly or biweekly VSP Premier rate. Thank you, Sonali, for posting that in there. That the employee-only rate for VSP Premier is $4.85 biweekly per paycheck. The next question mentions Delta Dental, but I believe it's for VSP, so I'll leave that there. If I don't use the Delta Dental Premier frame for the year, does it carry over so I get 2 frames the following year? So if I am incorrect and this is actually for Delta Dental, please do post in the Q&A, but I believe this is for VSP regarding frames.
Sorry, I was answering another question, sorry. So no, unfortunately, the frame allowance does not roll over. So it's kind of a use it or lose it benefit. So definitely would suggest using, obviously, your benefits within that calendar year if possible.
Okay, great. And it looks like my last question is going to be for dental. Could an out-of-network dental office submit claims on behalf of its client? And I see, Sharon, that you're responding, but if you could also respond audibly, please.
Yeah, so definitely, I'm not quite sure what they're alluding to here, because an out-of-network dentist, yes, would submit a claim to us to get paid. I'm wondering if this is more of if you maybe were out of the country and you sought services for an emergency dental treatment, and thus you had to pay up front, and then you would submit, right, that write-up from that dentist and in a receipt of payment that you made to that dentist, and submit a claim form to us. As for just regular, I guess, dentists and, utilizing out-of-network dentists, there's, we've got the claim form, and if they'll submit it on your behalf, great. A lot of times, though, why we're having you remit, or the dentist having you remit that claim form, is there's a box up at the top as to indicate if you prepaid, so you paid the dentist or not. So we know where to send the refund check or the the payment portion, right? What we're going to pay on this dental claim. So I'm hoping that I'm answering your questions correctly, but again, more than happy to take this one offline to just really make sure that I'm understanding what you're asking.
Okay, great, thank you. And that's it for our questions today. So I do want to thank everybody for attending. Also want to remind you, definitely sign in for that raffle. Make sure that we can give those prizes away. And if you do have any questions or any further questions, this will be posted onto our website, sfhss.org. And you'll also find contact information not only for our vendors, but for our member services folks as well. So thank you again for attending today.